So I think, what happened, what came with the pandemic was a focus on healthcare, a focus on response, which actually created a lot of challenges for other health areas. Immunization went down, TB patients were not getting services, HIV wasn't, etc. But what we realized also during the pandemic was that we were able to actually reach out to many more people much faster for COVID response. And that also brought out a lot of glaring gaps in the health system, areas where we can improve. It brought also health at the forefront of politics, at the forefront of economics, to really make it important as a subject that people should be focusing on. So public health has really come front and center at this point. And we need to use this moment to really go forward and try and make as much change as we can while we still remember COVID. So I think firstly we need to divide between screening and diagnosis. We're a large country with 1.4 billion people. There is no way that we will be able to reach good quality diagnostic to everyone. We need to do population level screening from a health and wellness perspective. So really be able to screen as much of our population as possible. And we need to have diagnostics closer to the population. Now, to get them there, we need a lot of health workers. We've got a health worker shortage. So technology is really going to be the only way that we will be able to reach the kind of population that we have and to bring some amount of health equity in this whole conversation. Otherwise, the poor will never get the services that they so much deserve. I think India's vaccination drive for COVID has really broken this whole rural-urban divide. We've really gone across the country, etc. I'm not sure if that's actually showing up in other areas. It's only for the COVID vaccination that we actually saw that coming together. And that was also thanks to all the information and the push from the government, etc. I'm really hoping that this will now start showing up in other areas of health. We'll be able to see this in other disease areas, in the larger immunization program. So let's hope we get there. Absolutely. I think we saw some large challenges. I think it was also because of, again, the population, the number of people that got infected, and the kind of challenges that we had there. Our facilities have multiplied across the country. There's been a huge amount of ecosystem building that's happened in terms of infrastructure. The challenge will be to keep this infrastructure together till the next pandemic. The challenge will be to make sure this infrastructure is working when that happens. But yes, I think we are better prepared from a pandemic perspective. I remember after the second wave, a lot of infrastructure was brought in after Delta. And by the time we got to Omicron, we were quite comfortable that if it was even double of Delta, we would be able to manage it. But yeah, we'll see how it pans out over the next few years. I would say the largest challenge is really this issue of nutrition, which starts, which starts from adolescent girls, goes across to early birth or early pregnancies, mapping all of that, and then it just becomes a circular situation, which we're not able to actually get out of. So, and then also the service side of it. Do we, do we have good antenatal care, prenatal care? What are our facilities like? So that whole piece, and being able to. I mean, we are still losing our maternal mortality and neonatal mortality. Those numbers are just not moving. That means we are losing many mothers and small children during childbirth, which is quite sad. So we really have to work towards those two. That mortality needs to really come down. And that's also a challenge for the Indian health system at the moment.